Hi guys, and welcome back to my channel. So I know I've been MIA for a fair while, and I thought it was about time that I let you know why. I did actually mention it in my last video that I would fill you in that there was a lot going on. So there has been a lot going on this year, and it's been a very, very difficult year, to say the least, so far. So I've waited this long because I've had to wait until I was at a point where I could actually talk about it comfortably without turning into a big blubbering mess. I'm not going to say that I'm not going to turn into a blubbering mess during this video. Actually, speaking of that, let me just grab some tissues. Right. So I guess the best place to start is at the beginning. So midway through 2020, our 12-year-old son Cohen, who you have seen, if you've watched any of my other videos, you've probably seen him in a couple. He's been in a few with me. He started complaining of pains in his left leg. Now, we took him to the doctors and they told us that it was growing pains due to his age and everything like that. There was no other reason to think that it was anything else. And then, you know, it just went on, and their pains would come and go, but they didn't stop him from doing everything that a normal 12-year-old boy would do. And he did complain a little bit more, and then due to COVID, it was very difficult to get in to see the doctor, like, in person. So we were doing telehealth appointments, and I had mentioned it to our GP, and he said that growing pains can come and go for years. So some kids get them, other kids don't. So again, wasn't anything that we were too concerned about. However, in December, like at the end of term 4, when the kids broke up for Christmas holidays, Cohen started waking up in the middle of the night in excruciating pain. So he was having Nurofen and Panadol and stuff like that for the pain, and we managed to, when it got to Christmas past and everything like that, and then my husband had to go and have a medical done for work, and we decided that because he actually had to go into the doctor, we decided that we would get Cohen with him. So Cohen went into the doctors with him to see about the pain in his leg. Our doctor at this stage decided that it was time to get an x-ray done. So on New Year's Eve, which was the day that my husband Michael had his medical, Cohen went to get an x-ray done on his leg, and when Michael and Cohen came out to the car, because I was sitting in the car waiting for them, he came out to the car, and Michael said the words that no mother ever wants to hear, or no parent wants to hear, which was, "We need to go straight to the hospital. Cohen has a tumour in his leg." So our New Year's was totaled, to say the least. So we went to our local hospital, and we went to the emergency department. They looked at the x-rays. The x-rays and report had already been sent through by the time we got there, so we actually had a pretty good idea of what we were possibly dealing with, and they told us that it was a sarcoma. They thought it was presenting like a sarcoma, which is a type of bone tumour, which we know now. So we basically went to the emergency room, and they said there's not much they can do for him there, so go home, enjoy your New Year's, and and then we had to go down to the Children's Hospital at Westmead, which is about an hour and a half away from where we live on the Central Coast in New South Wales. So of course we came home, didn't have a great New Year's because how do you celebrate after finding out that news? So we were all devastated, to say the least, but we were trying to remain optimistic because we didn't have any results at that stage. So New Year's Day came around and Cohen and I went down to Westmead Emergency. It's exactly what we thought it was. Went down there, they saw us, they said, okay, we're going to have a whole lot of scans done, they're going to have to do a biopsy. So we were booked in to have the biopsy on his leg done on the 6th of January. New Year's Day, he was actually told that he was no longer allowed to weight bear on his left leg. So we went in there, a normal walking 12-year-old boy coming out on crutches, which was very confronting and slightly overwhelming for Cohen. So he had the biopsy surgery done on the 6th of January, and then so we're all done and he's being his usual Coco self. Awesome boy. Most polite patient they've had, they said. Very. Just had to wait for the results. So we got the results back from his biopsy, and it was confirmed that what we originally thought, which was an osteosarcoma tumour, which is a rare kind of bone tumour. It happens mostly in teenagers, pretty much, adolescents and teenagers, and it happens in their growth bones. So yeah, then it was a case of running a whole lot more tests. The tumour in his leg was quite extensive. It's a 12.5 centimetre tumour. After we had those tests done, they made an appointment for us, and we went back to Westmead to get the results of everything. And this was our first real eye-opening experience as we were sitting. It was the extremely confronting day because we had our appointment at the oncology clinic in Westmead Children's Hospital, and it was very confronting not knowing at that stage exactly the extent of what was going on, as sitting in a clinic where you've got a lot of kids who it's where they go to have treatment for all different sorts of cancer. So the oncology clinic at Westmead is an amazing place, and yeah, they treat an array of childhood cancer there. So it's a very confronting place to be. So we found out then that unfortunately Cohen's that the cancer had actually metastasized to his lungs, and he has over 20 tumours in his lungs. So he's actually what they classify as stage 4. So they basically wanted to start chemo as soon as possible. So it was it was devastating. And it's still, it's, difficult. It affects everybody. So, sorry. So our Cohen's first cycle of chemo was in January, and he had 2 certain kinds of chemo, and they make you the first round he was extremely sick. He had before his chemo he had what they call a central line put in so he has a central line which is in his the right side of his chest, which is where they intravenously give him his chemo. So he got quite sick the first round of his first cycle of his chemo, which is basically when they're trying to work out all your antiemetics and making sure that they've got everything right to not make the kids sick. But unfortunately, Cohen ended up getting a staph infection in his central line, And so, yeah, so lots and lots of things. So, yeah, it was really, really confronting. I will put some photos in of Cohen before his chemo, and a little snippets of things that he's been going through. I'll pop them up here. 2 cycles of chemo, then they redo all of the scans to check on his progress. So I forgot to mention, in between cycles he also had to get his central line taken out and a new one put in because he got another staph infection in his line. So he was very sick, so he had to have his central line replaced, yeah, which was very unfortunate. And very on the 29th of March he had the start of his scans. So he had MRIs, CTs and PET scans to see the progress of the tumours, and to see that to ensure that the chemo was doing that it was meant to be doing, because they like to check before they continue on the regime, because if they need to make sure that it's doing what it's meant to be doing. So surgery was booked in. So after his scans and they booked the surgery in preliminary, and that was booked in for the 21st of April initially, and then we went back on the 6th of April. Sorry, I'm just looking at my phone because I've got all the dates in here. On the 6th of April to get the results of all of his scans and tests and everything that they did to see how everything was working. So when we went in on the 6th of April, we went back to the oncology clinic to speak to our to Cohen's oncologist, and unfortunately we were told that the chemo that they were doing hadn't worked, wasn't working, and that we needed to look at other options. So the first chemo that he was having was actually the chemo that works for majority of patients. So it's the one that shows the most promising results. So to hear that hadn't worked as they had expected was really devastating. So it had slowed the cancer growth, but it hadn't stopped it, and the tumour in his leg had gotten bigger, and there was a second tumour in his leg, and the tumours in his lungs had also grown. So not ideal. So we were actually on the 6th we were actually planning to get the initial plan was get the results and then continue with chemo on that day. However, because of the devastating results, our oncologist gave us options. So there was a different chemo that we could try, which is called IE, and also the possibility of a clinical trial for Cohen to enroll in. Now, in regards to surgery, at this point, at that point in April, our oncologist had suggested that she was not going to put him forward to have the surgery on his leg done, as in her own words, there was no point putting him through such an extensive surgery if he still had the tumours in his lungs. And so there was, it was basically like that putting him through it and the possibility of them having to amputate his leg, that it was just, it wasn't worth, the benefits didn't outweigh the risks. So they decided that the surgery was going to be postponed until we could get see if the new chemo had changed the tumour growth. Anyway, so we went home to think about things, and we ended up going back a couple of days later. She told us we could have up to 48 hours, so we went back 48 hours later, and we during those 48 hours I actually received a phone call from Cohen's tumour surgeon, who we had discussions with previously, because we'd actually booked in the surgery date and everything. So yeah, ended up having a discussion with the tumour specialist, and he had decided that he was going to, he wanted to do, that him and Jess had decided that they were going to do a tumour removal on Cohen's leg, purely for quality of life, is what they said. Which is a horrible thing to hear, but you know, they wanted to make it so that he wasn't in a wheelchair, and so that he was off the crutches and he was able to lead as much of a normal life as possible whilst going through this horrible chemo and dealing with this cancer. So there was risks, and we knew that they were going to remove as much as the tumour as they could, and they were going to, which meant removing his tibia and replacing it with a titanium rod. So it ended up being basically similar to a knee replacement, except all of the tibia bone was removed as well, or 90% of it, I think. So that surgery was still scheduled for the 21st of April. So we went back to Westmead Children's Hospital, and we went back to Westmead Children's Hospital, and Cohen had a cycle of the IE chemo, and then we were home for 2 weeks, and then he went into Royal North Shore to have the surgery done on his leg. So the surgery was 6 hours, and it was the most nerve-wracking 6 hours of my life. So he had the surgery, and it turned out that, like, when he came out of the surgery, Dr. Guzman let us know that he managed to get out all of the tumour, which he wasn't expecting to be able to do. So he managed to remove all of the tumour, plus the second tumour that was hiding behind the first tumour. So he was able to remove both of them, and he put in the rod, the knee. I'll insert a picture so you can see how extensive it is. So they did that, and they actually had Cohen up on the side of the bed, semi-weight bearing on his leg the next day.
Good job, using those arms, perfect. Keep coming, little steps. Good job. Let's do 2 more. Just got to get you in the right position to bed. You feeling dizzy?
No.
Good, keep me posted if you are. So just do another little step towards me. Beautiful. That's it.
The hang of
And
this.
then last one. Little step across. Good job. And then coming across. Perfect. Now can you try and step back for me? So we want to step back so you can feel the bed. Perfect. Now we're not going to sit down too quickly. Can you feel it?
So it was incredibly amazing seeing him in ICU and being able to, you know, get up and move around a little bit. However, once we got moved up to the ward the day after his surgery, so 48 hours after his surgery, He started losing sensation in his foot, and they discovered that one of the arteries to his leg had actually been severed. So he was rushed in for an emergency vascular surgery on his leg. So they took insert photos. So if you're queasy with surgical scars and stuff, then don't look at the photos. But yeah, they had to take a graft from his right leg, so his good leg. So they took a vein, 40 centimetre slice of vein from his right leg to put in the back of his left leg to do the artery graft, which is absolutely amazing that they can do that, and the technology and the surgeons my mind is blown by the work that they did. But they got the surgeon was able to restore blood flow, but that was at this stage the first surgery I had my husband with me, so that, you know, we were together, so we had support. But the second surgery, because it was like an emergency surgery, I was there by myself because no one was expecting it. So it was like 6.5 hours, so it was longer than his first surgery. So it was gut-wrenching, to say the least. So it's been pretty fun. But I'll insert some amazing footage of how far he's come. He was up, I think it was 2 days after his, excuse me, we ended up being in ICU for 4 days, and then back up onto the ward, and they got him up walking. Nope.
Even if you just do smaller steps, that's fine as well.
He's doing it.
Oh, you got your shoes on?
Yep.
Got one of them on?
Well, I think it was day 4 or 5. So he was walking with a walker, but he was walking, and it's amazing. The strength that he has is just phenomenal. So after 10 days being in North Shore Private, they decided to transfer us to Westmead Children's Hospital for the rest of Cohen's recovery. Cohen was transported by ambulance, and I drove over. And on the way over to the Children's Hospital at Westmead, I received a phone call from his tumour surgeon, and he let us know that the pathology had come back on the tumour, and the tumour was 90% necrosis, which means it was 90% dead, and all of the margins that he removed were clear. So not only did he get it all, but it was 90% dead and all the margins were clear, which means that at this stage, as far as we are aware, there is no more tumour, no more cancer in Cohen's leg. So it is just in his lungs at this stage. So we just have to sort out the lung ones, which was just amazing. And when I got to the Children's Hospital, when I got to Westmead and I told Cohen, he just cried hysterically. He was so happy. It was just the most amazing feeling to finally have some good news to tell him. So yeah, that was just fantastic. And then so we were at the Children's Hospital in Westmead, and we were there on a high for once, which was really, really cool. And then
Probably get to like the
sorry.
that door right there, and then I'll turn around.
I'm on board. Whatever you like. You got a fan club in the car. No pressure.
Come on, come to these doors.
Good job, dude.
Thank you.
And we were transferred to a different ward because for Cohen's recovery, and we were there, and we so yeah, and Cohen did actually get to celebrate his 13th birthday, which was on Easter Sunday, and miraculously somehow it worked out that we were actually home, so he didn't have to celebrate his 13th birthday in the hospital, which was one huge bonus. And so Cohen really wanted to be home for his brother's birthday on the 12th of May. And it was so close. We nearly didn't make it. We were there for a recovery, and it was taking a lot longer than they expected. And then Cohen got a temperature and a urinary tract infection and all these sorts of things. So we actually we got discharged on the 12th. And so he made it home for my son's 14th birthday, which was amazing. And then yeah, so we were back home for a little while, and then we had to come back down to see our oncologist, and went back down and we met with her and started on, we found out we were actually accepted into the clinical trial. Well, Cohen was, not we. Cancer is a whole family thing, just if you were ever wondering. It affects everybody in the family, not just the person with it. But yes, Cohen was accepted into a clinical trial. So that's what we've been doing. So that's where we're at the moment. We are, we've just done his second cycle of the clinical trial, and he's been having extensive physio. 7 weeks after surgery, he was allowed to bend his knee for the first time, which was absolutely amazing. And I'll share some videos of him walking and showing you the progress that he's made. And yeah, so yeah, that's where we're at the moment. We're still taking it one day at a time, and I promise for my own mental health I need to get back into DIYs and all that sort of stuff, because I actually have a little bit more time on my hands at the moment, because unfortunately one of the casualties of Cohen's diagnosis is that I had to resign from my job, which was a job that I loved, but it was a very difficult decision, but I needed to be there for my boy, and someone needed to be in the hospital with him to stay overnight. And when in the beginning we didn't actually have a set schedule, we didn't know what days we were going to be in and what days we were going to be home, and I honestly thought that, you know, he would be able to go to school when he was home and stuff like that. And I guess you could say I was slightly naive, but I didn't want to think that he was going to be so sick that he wouldn't be able to go to school. So it turned out that he's only been to school, term 1 he went 3 days in total, so it was like 1 full day and 2 full days and 2 half days he managed of school in term 1. And this term, which is term 2, which is about to end, he actually went to school today for the first time in term 1, and he was so excited about going to school, and he lasted the whole day, and he had an awesome day, which is great. So walking into school. Tomorrow we are back off down to Westmead to have dressing changed on his leg for one of his scars, which is sort of split open a little bit, and to have bloods done, and then we're back home, and we're back home for the next 2 weeks, which will be awesome. So I'm going to try and get back into my office and do some more DIYs and upload some more videos for you, because I think for my mental health I really need to get back in to my office and doing some crafting and DIYs, because I just, yeah, my brain finally feels like it's ready to actually start something again. So I do want to say, whilst I'm here and before I go, I just want to say an absolutely massive thank you to anyone who has donated to the GoFundMe page that my sister set up for us. When I had to resign from my job, we're you know, we're not wealthy, so we live pretty much week to week. We were living week to week. So the GoFundMe has been amazing, and we've also had other donations. I attended a charity day a few weeks ago now, where Cohen was the beneficiary, which was amazing, and Sleepy's Foundation, if you I'll link them down below. They're absolutely amazing. They're like family. So yeah, a huge thank you to everyone's support, to the people that have made us dinners and offered to look after my eldest son and everything like that. It's just, it's been amazing. We wouldn't have got through it. I mean, we're still taking it one day at a time, as I said. But yeah, thank you. And I'll see you in the next video, and hopefully it'll be a little bit different. But I did want to, as I said, I did want to let everyone know where I've been, and I needed to talk about it. And yeah, you know, I can sort of hopefully maybe bring some more awareness to osteosarcoma as well. As I said, I'll be posting some information from time to time on my Instagram and my TikTok page. So yeah, feel free to follow me over there. So thanks, and I'll see you in the next video. Bye.